Hello friends. Ovarian cancer, what is it? When abnormal cells in your fallopian tubes or ovaries grow and multiply uncontrollably, ovarian cancer develops. The female reproductive system includes ovaries. Throughout your reproductive years, these two walnut-sized, spherical organs produce eggs. Who is prone to ovarian cancer? People assigned as female at birth, AFAB, and women are both affected by ovarian cancer. Native Americans and white individuals are slightly more likely to experience it than are Black, Hispanic, or Asian people. In addition, having a BRCA gene mutation significantly increases the chance of developing breast and ovarian cancer in adults of Ashkenazi Jewish origin. 1% of all new cancer cases in the United States are ovarian cancer instances. About 1 in 78 people may acquire ovarian cancer in their lifetime. What signs are there in ovarian cancer? Before you notice any signs, ovarian cancer can grow and spread throughout your abdomen. Early detection may be challenging as a result. Symptoms of ovarian cancer can include discomfort or bloating in the abdomen or pelvis, alterations in eating patterns, early fullness, and loss of appetite, vaginal discharge or unusual bleeding, particularly if it happens outside of your regular menstrual cycle or after menopause. Constipation or diarrhea are examples of bowel changes. A growth in your abdomen's size. Frequent urine. More frequent urinating. Plan to see a doctor if you experience any of the symptoms mentioned above. Why does ovarian cancer develop? Ovarian cancer's precise cause is yet unknown. However, certain people are slightly more likely to develop the disorder. Risk elements for ovarian cancer include being over 60 years old, obesity, having ovarian cancer runs in your biological family, having inherited a gene mutation, BRCA1 or BRCA2, or having Lynch syndrome, never getting married or having kids later in adulthood, endometriosis. As you age, you also run a higher risk of having ovarian cancer. Ovarian cancer spreads in what way? Ovarian cancer typically spreads from the pelvis to the lymph nodes, abdomen, intestines, stomach, chest, or liver if it does. In what way is ovarian cancer identified? Despite years of study, specialists still haven't created a reliable ovarian cancer screening test. Because of this, it might be challenging to detect the illness in its early stages. Your healthcare practitioner will inquire about your symptoms and conduct a pelvic exam if they have a suspicion that you have ovarian cancer. They'll look for any unusual growths or enlarged organs during the examination. They might suggest extra tests, such as imaging exams. Providers may employ a range of imaging procedures, such as abdominal ultrasound, magnetic resonance imaging, or MRI, computed tomography, scan, positron emission tomography, PET, a blood test. During blood tests, the chemical CA-125 is sought after. Cancer may be indicated by high blood levels of California-125. However, CA-125 levels can be greater in numerous non-cancer diseases and can be normal even when cancer is present. As a result, doctors combine blood testing with other examinations to identify ovarian cancer. Surgical assessment. During surgery, medical professionals can identify ovarian cancer. Normally, they remove any abnormal growths they uncover during the same process. Laparoscopy. In laparoscopic surgery, a small incision in your abdomen is used to insert a thin camera, laparoscope. The surgeon can evaluate the cancer, conduct staging biopsies, and, in some cases, remove ovarian tumors using the scope as a guide and extra ports to carry equipment. What stages of ovarian cancer are there? Ovarian cancer progresses through 4 phases. The least severe is represented by the lowest number in this system of cancer staging. The number rises the more serious the problem. Stage 1. Stage 1 is broken down into Stage IA, Stage IB, and Stage IC. There is only one ovary or one fallopian tube affected by cancer in the first substage. Cancer in the fallopian tubes or ovaries is present in Stage IB. Stage IC cancer is located outside of your ovary, on the outside of the organ itself or in the area around the ovary, known as the peritoneal cavity, in both of your ovaries or fallopian tubes. Stage 2. Stage 2 is further broken down into a few stages. In stage IIA, the cancer has progressed to your uterus in addition to your ovary. The cancer has progressed to further adjacent pelvic structures at stage IIB. Stage 3. There are 3 substages in this stage. In stage IIIA, the cancer has microscopic spread to your abdomen or lymph nodes from the pelvis. The tumor is up to 2 cm in size and has spread outside of your pelvis or inside of your lymph nodes in the second substage, stage IIIB. In stage IIIC, the cancer has spread to other parts of your body, is larger, more than 2 cm, and may even be present inside your lymph nodes. Your liver and spleen, among other organs, may be affected at this point. The most serious form of cancer is stage 4. At this point, the cancer has invaded the interior of various organs, including your liver and spleen. In stages EVA and IVB, the cancer is detected close to the lungs and has spread to the chest or groin lymph nodes, respectively. Staging is crucial since it aids in the creation of a personalized treatment plan for you by your doctor. Your healthcare professional will discuss your treatment choices with you. The way that ovarian cancer is handled. The aim of cancer treatment is to get rid of as much cancer as you can from your body, if not all of it. The following are typical ovarian cancer therapies. Surgery. This normally entails the removal of any cancerous organs as well as your reproductive organs. Laparoscopy, a minimally invasive procedure, or laparotomy, an open procedure requiring an abdominal incision, may be used by your surgeon. Chemotherapy. Chemotherapy may be suggested by your doctor either before or after surgery. Drugs used in chemotherapy are intended to find and kill malignant cells. Chemotherapy may be administered orally, in pill form, or intravenously, via a vein, by your healthcare professional. Targeted treatment. Drugs are used in this cancer treatment to locate and kill cancer cells. Targeted therapy alters the division and growth of cancer cells. Hormone treatment. Hormones are used by some ovarian tumors to grow. The growth of cancer is slowed or stopped by this sort of therapy, which suppresses hormones. Radiation treatment. Radiation therapy is rarely used by doctors to treat ovarian cancer. After your ovarian cancer treatment is over, your doctor will want to check in on you frequently for observation. To be sure the cancer hasn't come back over time, you might have regular checkups. Your doctor may perform an exam and go over any potential symptoms during these visits. Be aware of any symptoms you might be experiencing and let your doctor know about them. Your doctor may occasionally request imaging tests, usually a CT scan. Obesity. Can I avoid developing ovarian cancer? Complete prevention of ovarian cancer is not possible. However, being aware of your biological family history might help you be ready for any potential increased risk of ovarian cancer. Your healthcare practitioner might advise risk-reducing surgery to remove your ovaries and tubes before they develop cancer if you have a genetic mutation, such as the BRCA mutation. Ask your healthcare practitioner about genetic testing if you're unsure if you have a BRCA mutation or another mutation. This video is for information point of view only. Take care. Thanks for watching this video. Please like, share and subscribe.